Hello, I'm Janelle Thompson and welcome to another episode of What the Health. So today we're doing something a little bit different, and this was a recommendation of one of our medical assistant program students. There is an offering that's going on this week for all of the students here at the college. There's going to be some screening performed for blood glucose and for high blood pressure. So I'm going to talk a little bit today about type 2 diabetes and hypertension. Type 2 diabetes is a process where our body has difficulty utilizing blood sugar or glucose. Some of the symptoms of diabetes would be increased thirst, increased urination, mental confusion, hunger. Being at risk for type 2 diabetes does have some influence of our family genetics. Otherwise, people who are overweight or obese are more prone to develop type 2 diabetes. Those of us who have a sedentary or inactive lifestyle, those of us who have sleep apnea, those with high blood pressure. If diabetes is identified early on, it can be in many cases slowed, prevented, and it's quite easily treated early on if there's good collaboration between the patient and their healthcare provider. So what are different ranges for blood sugar readings and what do they mean? I would like to see a normal level being less than 100. If I see a level that is from 101 up to 125, that's where I get concerned about, is this pre-diabetes, or what is also called impaired fasting glucose. In a level that's 126 or higher, I would do additional testing and probably consider that person to be a type 2 diabetic. It's in the range of the 101 to 125 where I can make the most difference for patients. If somebody is in that range of impaired fasting glucose, pre-diabetes, they have a 25% chance of progressing to type 2 diabetes in the next 4 to 10 years. Next, we're going to talk a little bit about blood pressure. So what is blood pressure? Blood pressure is a measurement of the pressure of your blood during heartbeats against the arteries in your body. So we have two numbers when you get your blood pressure taken. We have the top number, which is your systolic, and that is the measurement in millimeters of mercury of the pressure of your blood against the arteries when your heart actually is taking its beat. And then the diastolic is actually the measurement in between beats. So really at the time when your heart is resting and when the heart is refilling with blood. So what are some of the causes of high blood pressure and who are the people that are at risk of having high blood pressure? Again, just like with diabetes, this can go back to your family history. But otherwise, our lifestyle can play a big role in whether or not we are predisposed to having high blood pressure. So what is your stress level? Are you actively exercising, or are you one of those people that are sedentary and sitting at a job in an office, sitting on the sofa? Are you smoking? Are you drinking more than 1 to 2 alcoholic beverages a day? Do you add a lot of salt to your foods? Do you have sleep apnea? Are you a diabetic? Also, the aging process. So as we get older, our blood pressure does tend to elevate. And generally we see blood pressure elevating more commonly as we get age 45 and above. What could be some symptoms of hypertension? Ringing in the ears, the sound of a heartbeat in the ears, headaches, changes in vision, dizziness. What are some side effects if you have high blood pressure or hypertension? That can lead to hardening of the arteries. It can cause your heart muscle to get larger. High blood pressure can cause your arteries to enlarge in areas that they're weakened. That's called an aneurysm. It can also put you at high risk for heart attack and for stroke. So where is our blood pressure supposed to be? So ideally, a normal blood pressure would be the top systolic number around 120 and the lower number, your diastolic, around 80. If blood pressure is reaching where the top number is about 139 and the bottom number 89, anything above that, we're reaching stage 1 of high blood pressure. And so below that, that's where we can be pretty effective in working with lifestyle changes. And ideally, that's what we do first, is try to get things under control, things that can be influenced by what you're doing every day, rather than jumping at working with medicine first.
Hi, my name is Gwen Malik. I am the Practicum Coordinator for the Medical Assisting Program.
My name is Dominic Griffin. I'm an alumni of the Medical Assisting Program.
And I'm here to talk about Medical Assisting Week, October 18th to the 22nd. We are highlighting medical assistants and what they can do out in the field. We're going to be checking anybody that wants to come in for blood pressure, and we're going to also check their blood glucose. It's really important. They are practicing all the time, and this gives them more opportunity to get that extra experience when it's just not them in the classroom, so it's people that they don't know.
I felt like it helped with confidence a lot, like it really got your confidence boosted up because you knew that you got to practice hands-on, so you knew you already knew how to do it when you got out into the field. So you really you're like, I got this, like I don't have to worry or freak out or panic about it.
Thank you for joining me for another episode of What the Health. Please continue to send questions and comments to the Student Health Clinic. And again, no topics are off the table. We're happy to be able to help you and happy to bring you these episodes and answer some of your questions.